For all.
Thank you. Now, if we could do our roll call, Sheila. And remember, everyone, we are working virtual, so please, when you indicate you are here, identify where here is as well.
Thank you. Ms. Bernard. Mr. Furman.
It was Swanson, but it's under Richards.
I think we're gonna have to put something on mute.
Yeah.
Dr. Hans.
Here.
And can you state your location, Dr. Hans?
I am here. I'm in Bloomfield Hills.
Thank
Dr. Guadalupe.
Here in Oakland Township.
Mr. Lindemere.
Here in Las Vegas, Nevada.
Ms. Namie Dyer. Ms. Newman.
Here in Pontiac, Michigan.
Ms. Root.
Here in Rochester Hills.
Ms. Summers.
Here in Royal Oak.
Dr. Taub.
Here, Bloomfield Township.
Mr. Torres.
Here at Waterford, Michigan.
Ms. Bernard.
Here in Fort Myers, Florida.
Mr. Furman. Mr. Furman did let me know that he might be a few minutes late. So, Mr. Landsman.
Here, West Bloomfield Township.
You're all set.
All right. Have we missed any other board members who had a mute issue? Hearing none, the next item is public comment.
Hello, everyone. We do have one public comment that was submitted earlier today from Carla Dean. She says, I would like to thank OCHN for supporting the vocational provider community with stability payments during COVID. Attendance continues to be extremely reduced due to the health and safety concerns of individuals and their guardians. Vocational service agencies provide a valuable service to the community, and New Gateways relies on the stability payments to stay in business during this time. Please continue to offer the stability payments during this time of decreased attendance. And I do just want to remind anyone, if you'd like to submit public comment tonight, you can do so through the chat, and we also have an online form.
Thank you. All right. Next is the approval of the February 16th board agenda minutes. Oh, I'm sorry. No, of the board agenda. Can I get a motion to approve the board agenda?
This is Eric. I move to approve the agenda.
I'll second. It's Malkaya.
Thank you. All those in, is there any discussion on the motion? All those in favor of approving the board agenda for tonight, say aye.
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 Any opposed? The motion carries. Okay, next page. All right, next item on our agenda is one of my favorites. It's the stories that inspire. Tonight it's about student leadership services, and it's presented by Dawn Flood, who is part of our student leadership services program. So welcome, Dawn.
Thank you. Thank you very much. If you could have the slide, please. Okay, next one. All right. Student Leadership Services, SLS is the acronym, is a Michigan-based nonprofit dedicated to ensuring that our students remain safe, healthy, and alcohol and drug-free. And we do this and accomplish this through innovative and evidence-based prevention programs, which are student-led, adult-supported, and they're within a school. And two of the programs that we coordinate is Students Leading Students, and you're going to hear from a student tonight about her experience in her Students Leading Students chapter at her school. And our other one is our middle school program, Students Taking a New Direction, or the acronym is STAND. And so we're happy, my student and I are happy to be here tonight to share with you what Students Leading Students is and what students learn and contribute to their community and school. Our organization's long-term vision is simple, that every student can be a positive leader with changing thoughts and challenging behaviors. We know that there is extreme power in student voice and student influence. And you'll hear some of that from Hayley tonight. Our core values of our organization is we're a credible organization, we're honorable, we're accountable, we're respectful, we're always learning. Research is a huge part of who we are and what we do. We're driven by the research and inclusive. Next slide, please. And so I'm honored tonight because standing next to me at the SLS office in Waterford is where we are, is every year Student Leadership Services gives out annual state award to a student who goes above and beyond in their school and community, who really is committed to helping their peers make healthy and safe decisions. And so since 1988, we've given out an award to students. And so for this year, and she's here tonight to tell you about her experience, I'm excited to let you meet her. But her name's Hayley Lippman, and she's a junior at Walled Lake Northern High School. And she's been involved in Students Leading Students, or the SLS program, since her freshman year. And so I want to kind of turn the floor over to Hayley, and she'll inspire you with what she has been working on. Hayley?
Hello, everyone. My name is Hayley Lippman, and I'm a junior at Walled Lake Northern High School. I'm currently the proud president of the Students Leading Students Club at Walled Lake Northern. I'm just going to start off really strong and say SLS has changed my life. And I'm not just saying that because that is what someone told me to say, or because I'm talking to a bunch of extremely important and influential adults. I'm saying this from the bottom of my heart. SLS is one of the best things that has ever happened to me. Not only does SLS provide a community support network, but it also provides a safe space for teens to grow and develop their individuality. Before diving into the amazing projects we do, I would like to make a small disclaimer. I am only one of the many students that are impacted by SLS. Of the 35 members in Walled Lake Northern's club, each and every one of them has a different story on what they have gained from SLS. This fact is extremely important because of the various benefits I have seen and continue to see it provide. Of the numerous projects we do, I would have to say the Zen Den is my favorite. The Zen Den is a classroom outside the school's common area that SLS, thanks to the support of you, was able to put together. As you can see, there are couches, yoga mats, oil diffusers, fidget toys, and countless other stress-relieving objects. Because of the Zen Den, we are able to help teach students how to better manage their stress and anxieties, both at school and at home. I could seriously talk about how amazing the Zen Den is for hours, but I cannot go without mentioning our incredible You Matter / Knights Matter Week project. Next slide, thank you. During this week, we are fortunate to get the whole school together for an impactful assembly that outlines the importance of taking moments for yourself. In addition to this, we make a poster every year, as you can see in the top left corner, where every student writes something that makes them happy or something they're grateful for. This allows students to take a moment to themselves and recognize that even through their stressful day-to-day life, there are reasons to keep pushing. We then take their stories and hang them up next to each other, symbolizing harmony and togetherness. I am beyond happy to say that Walled Lake Northern is having another You Matter Week this year. We are focusing on celebrating life and finding small victories in the daunting world we live in now. In addition to these projects, SLS is proud to bring up Car Safety Week, Earth Day cleanup, and other various random acts of kindness to Walled Lake Northern. Next slide, please. Over this past holiday season, SLS was able to collect over $3,000 in donations for our Walled Lake Northern families that needed extra support. It was overwhelming to know that our school was so willing and eager to help alleviate some of the holiday stress for our classmates. As you can tell in some of the pictures, SLS members smile together even when we are not deliberately working on projects. In the picture in the bottom right corner, SLS members are having some virtual fun at our annual holiday party. I could go on and on about these projects, but the point I'm getting at is how SLS is focused on the total well-being, including mental health, of the students. Unfortunately, our generation has been forced to mature and learn how to face unimaginable realities. We are forced to continue with our day-to-day education, often overlooking our mental health. At SLS, we take a unique approach by acknowledging and embracing the difficult times while using them as a stepping stone to greater our success. Without going into too much detail about my personal mental health struggles, SLS has changed my life in such a positive way. When I am with SLS members, I feel encouraged and empowered. SLS members are different in the fact that we care. I'm proud to say that I'm a part of an organization that actually cares. When people figure out I'm a part of SLS, I hope they acknowledge I am a safe ally. If they want to talk, they know that I, as an SLS member, are there for them. SLS is way more than a club. SLS teaches compassion, leadership, and support in a way that no other organization is able to. SLS has been such a motivating and empowering influence, and I'm beyond grateful for the opportunity it has provided. Thank you so much for taking the time out of your busy day to hear me gush about how incredible of an organization SLS is. I truly hope you all have an amazing rest of your week and recognize how much your support impacts ordinary students like me.
Thank you, Hayley.
Hayley, Dawn, thank you both. Is there anyone on the board that would like to ask Hayley or Dawn a question? Yes, I have Sarah Guadalupe.
Thanks. Not a question. I just want to thank you, Hayley and Dawn, for sharing. Hayley, wow, is all I can say. The program sounds wonderful, and you are so articulate, and to get up and speak in front of us takes a lot of courage. And even when I get up, I get nervous talking in front of people, and you just, it was like a breeze to you, it seems. So just kudos to you. I really enjoyed hearing about it in the program, and just happy to hear how great it's been for you. So thank you so much for being here tonight.
Thank you.
Melchiah Newman.
Hello, Ms. Flood, and hello, Hayley. It was very, very energetic, to say the least, presentation. And I'm just curious. I wasn't exactly sure how SLS provides support to the students. Is it? Could you explain that just a little bit more for me, please?
Yes, and actually that's going to be the next part of the presentation.
Oh, okay.
I will answer that question as we kind of move along.
Okay, then if that's the case, then I just want to compliment you on your work with the students, and I love the Zen area. We have on my team at work, we always do a meditation before we start our meetings, and we understand the importance of self-care. So you getting it at an early age is really phenomenal. So thank you for your presentation.
Yes.
And Don, I will turn the DS back over to you.
Okay, excellent. Thank you. All right. So Hayley is remarkable, and I'm so happy and excited that she's here tonight, and that she's represents the state organization for the SLS Student of the Year. And so how does Student Leadership Services, what do we do to support students like Hayley? Well, we have our leadership team. So we have our executive director has been involved since 1982. I myself, the program director, has been involved since 2004. We have a small board made up of 7 sectors from the community and corporate world, all the way from Ford Motor Company to teachers and lawyers. Next slide. And so a little background about Student Leadership Services. We're the nonprofit, and we have developed a nationally recognized and comprehensive whole child approach to prevention programming for students ages 11 to 19. Our high school program, which Hayley is a part of and spoke on, is Students Leading Students. And our middle school program is Students Taking a New Direction, or STAND. And what the program does is we know that when students are actively engaged and challenged to lead, they become role models for their peers. And when they become role models, they then will internalize and become those healthy, productive individuals. One of our models at SLS is to provide an inclusive, safe environment. Everybody is welcome. Doesn't matter what their leadership style is. It doesn't matter who they are. Everyone is welcome. And that environment happens through the confidence that the students learn through the skills that SLS provides, but also with the support of their school advisor. Hayley has support of 2 school advisors that kind of guide the activities that they do in their school. Everything that we do in SLS is based on research, from youth development to the principles and characteristics of effective prevention to developmenting the assets. Everything is based on research. And so the goals of our program is that students like Hayley will learn those skills, practice them so that they can refuse when it comes to using alcohol, tobacco, or other drugs, that it'll be automatic and that they'll have the confidence in themselves, as well as learning and practicing those key executive functioning skills that everyone needs. And SLS does that through substance-free cultural norms. Groups like Hayley at Walled Lake Northern, they create that culture in their school, that this is a safe place to be, that this is a fun place, a place that we make decisions and everyone's included. And they do that by promoting safe and low risk behaviors, such as safe driving. And Hayley talked about that when she was talking about the Car Safety Week, but also through her, when she referred to You Matter Week, safe online practices. The key to Students Leading Students is in the name, Students Leading Students. If you notice, Hayley was talking about what her members, her other high school members, were doing in the projects. I don't think she once mentioned her adult advisors. They're there, okay, but it's not teacher-led or teacher-driven. It's all about the students. And when they have those opportunities, they then make that commitment to that long-range goal of being drug-free and healthy decision-making. And they do that through the fun, engaging activities. A couple of the samples Hayley shared with you. Next slide, please. And so what does the organization, okay, in my role, what do we do to support students like Hayley and the other SLS groups across Michigan? Well, one of the things is new this year, one of the things I'm proud of, even though this last year has been challenging for many, we took our boots on the ground program where I usually go into the schools and do the skill-based trainings for the students and for the advisors that lead or co-lead the group. And we shifted and we went to online, still knowing the importance of the boots on the ground, which that's still a key factor. But so for this year, we were able to launch new online tools to support students in the program. We have a Google Classroom that's set up for students and advisors of the group, of resources, materials created by students. There's things in there that are correlated to research and national prevention initiatives so that they have a source and a hub to go to find information to help them with whatever their project is, whether it's You Matter Week, whether it's suicide awareness, whether it's educating about the health consequences of underage drinking. It's there, it's kind of the hub. And with that is we created a chapter planning tool, we call it. But what it is really is it's a year-long calendar to support student projects that the groups do are correlated to the national initiatives, okay? And everything in there is correlated to what the students have done in the past to their ideas in the future. And so we do that through materials, handbooks, student-created workshops and agendas. Our organization has been around since 1982, so we still have, you know, paper copies of speeches from students like Hayley that wrote and presented at state and national conferences when it comes to making good decisions. We provide online and on-site trainings on many of the executive functioning topics, such as resistance skills, the coping skills, decision-making, the ATOD education and awareness. And the other thing that's really great about this organization too is Hayley's a junior, but in 2 years, she will graduate and she will be considered an SLS alumni. SLS alumni, like Hayley, they give back. They now are young professionals and careers, and many of them come back to SLS and they support us, whether it's by sponsoring a student from their alumni high school or coming to one of our conferences or events and giving workshops or supervision. And so they really understand what they learned as a student and has carried them over to their adulthood. And so they give back. And some of them, they'll write a check. And we love when they do that because, it goes directly to students like Hayley. We have student-led conferences, trainings, and presentations. And we really walk the talk when we say student-led. It's students like Hayley that are educating and leading their peers in the right direction. I'm just there for support and to provide the opportunities. We have online video curriculums and trainings that can be helpful for if a chapter, can't have in-person things. They have those resources. And so those are kind of the background of the two programs that are ours that we developed and coordinated. Students Leading Students has been recognized by NREP, National Registry of Evidence-Based Programs and Practices, in 2017. Has been recognized by SAMHSA for a couple years on awards. And so we're really proud of that. Other curriculum that our organization also provides, and this is open to all students. They don't have to be in the SLS group or STAND, but we implement the BOP and life skills training, all levels. Right now, currently, I'm doing the elementary and middle school version in Troy in Waterford. Prime for Life, that's a new program that we're getting our feet wet in right now. And I'm excited to start implementing that program. And then the two parent programs, Guiding Good Choices and Strengthening Families program. And both of those programs I absolutely love. I'm a social worker. And so, whenever you get into, the assets and the resiliency factors and everything, I just eat that up. So I really enjoy doing those parent programs as well. Next slide, please. So number served. SLS directly serves approximately 4,000 to 8,000 students annually statewide, okay, through our trainings and workshops. We're a statewide program. Oakland County specific is approximately 1,600 to 3,000 annually. And with that number, students like Hayley receive multiple program exposures, anywhere from 2 times to 18 times, depending on what they participated in. And those students that are directly served impact between 10 to 20 other students in their school and community with their health and safety projects and activities. So when Hayley was telling you about the You Matter Week and the Zen Den, and she gave credit to her other 35 SLS students that were part of creating that. So it was those 35 students that came up with this idea and created it and then implemented it. And that reached every student in that high school. And that high school has over 1,000 students. So that impact right there is huge, tremendous, very cost effective. Next slide, please. Service sites and location. So the organization office is physically located in Waterford. However, we service schools and communities statewide, including the Upper Peninsula. I even go to the Upper Peninsula. The schools and communities that are serviced this school year in Oakland County are this list, and I won't read them because you can see it on your screen. And some years it's more, and some years it's less. It just depends on the year. And even though we're in COVID, we're still able to service both, meet the needs of in-person and online virtual through these school districts. And these are a combination of middle school and high school. I just put the city, but we're doing service in both age brackets. Next slide, please. Community engagement. And so I actually had to think about when I was putting together the slide, because when I think of students and when somebody asks me, how do they reach their community? Well, the school is the students' community. I mean, that's where they go. That's where they spend their time. And so when we talk about community, when it comes to students, we have to recognize that their school is really where their community is. And so SLS provides students with engagement opportunities that create that community and belonging that Hayley was referring to. We create that community by having a nurturing and supporting environment for the students. And when that happens, something happens in the school. There's like a shift in school climate when you have a group like SLS that is promoting kindness and that you matter and taking care of yourself. You see that shift in the school climate for the better, and the students become connected and feel like they have a positive place. And they do that through the schools, or through the skills that they learn. And so SLS helps students prepare for their careers by teaching them job readiness. Because again, part of teaching students skills and looking at the whole child is helping them learn those job readiness and leadership skills, and giving them the opportunities to work together as a team to achieve their goals, no matter what their goal is, whether it is educating on marijuana use or educating on safe driving. SLS educates and prevents. We're a force of prevention for ATOD problems, and we engage student to tackle what is meaningful to them. And that's one of the things that I'm really proud of, is that we ask the questions and then we listen, and then we help the students find a way to create that change that they're looking for. And we do that through the boots on the ground, going right into the schools and doing what it is that they need for the support. On the right side is just a kind of a fun flyer that I just wanted to share with you. These are some of the different workshops that students said that they would like to have for winter, so February and March. These are kind of what we focused on for safe driving, how to raise money for your groups, how to have leadership, how to communicate with adults respectfully. Many times students will say, it's scary talking to adults. How do we say to them what we really want to say, but respectful so they listen? And that's one of the things that SLS provides, is that platform for them to do that. Next slide, please. Person served. So how do we engage students? So there's 3 strategies that we use. We listen to students, okay? We ask the questions, and then we listen to what they have to say. And then we engage students. We provide them with the skills they need, give them the confidence. And when students know that they're heard, you got them. They'll have ownership with the projects they're planning. They just need to be listened to. And then we coach the students in the leadership skills. And then we let them lead. And one of the things that I know adults, and I myself know that this happens, is, sometimes that it's hard to step back as an adult and let the students take the reins and lead with something. Because what would take an adult 5 minutes to do may take students 2-3 meetings to figure out, okay? But it's not the adults that have to learn it, it's the students. And so we have to have the confidence, sit back and let them lead, be there to support, help guide them, but trust them enough to do what they know needs to happen to make change. Next slide. How do you know it works? Okay, and so that's one of the questions that I get from principals when I meet with them about our programs. They'll say, how do you know it works? Okay, we have the data, right? We have the outcomes of the evaluations and the research study that says, you know, they learned how to say no, okay? They know how to practice safe driving behaviors, okay? But there's the other side of that, and it's if you ask the students the question, what did this mean to you? Or what did you learn? How will this help you? They will tell you. And so this slide, and again, I won't read it because you can see it, but I always ask these processing questions when I'm with students after an activity or after a conversation. And these are the words. These are the words right from the mouth of the students. And so that right there is what's empowering to me and lets me know that students like Hayley, they're really getting the experience that we want them to get. Even parents. I had a workshop that I did on human trafficking. It was just an hour workshop, and it was on helping students recognize the signs of human trafficking and how to keep themselves safe. And I had a parent that was on that workshop with their seventh grade daughter. And at first, I thought the parent was just sitting in because I wanted to make sure of what I was saying to their seventh grader. But what ended up happening was awesome because the parent sat down with the other students in the workshop that they didn't know, their daughter didn't know, and they had a real conversation. And the parent shared aspects through a parent's lens, that why parents tell their children to be safe online, why parents have these rules, why parents say these things. And so one of the things following the workshop, the parent emailed and said, this was a great conversation starter, that she always talked to her daughter about, you know, being safe online and your surroundings and everything. But having this workshop opened up the door for them to talk further and let their daughter know that it wasn't just a mom thing. You know, this is something that really happens and they need to talk about. So I was really happy because that mom didn't have to tell me that. She went out of her way to give me that feedback, which, you know, says, wow, you know, they were really engaged with what the topic was and what they were learning. Next slide, please. Advocacy priorities. And so one of the things that SLS does is we build supportive relationships and that rapport with students, but also with the advisors that support the student groups like Hayley's involved in. And we do that by strengthening their executive functioning skills, helping them learn how to, you know, plan a meeting agenda. At the beginning of this board meeting tonight, you had an agenda, okay? As adults, we know how to do that. Well, students like Hayley, they have to learn to develop that, what goes into an agenda. And so they learn things like that. And they learn how to plan an activity, how to have a celebration, and how to involve and influence their peers. And in the process of helping others, students help themselves. And that's one of the key things. And so our job is to provide resources and materials to help them implement their projects, to provide that platform and opportunities for students to share their voice on what matters to them, and empower students to make the change they know that they need in their school. And we do that by providing engagement, opportunities, belonging, acceptance, and inclusion. Next slide. Is that my last one? Oh, it was. Okay, excellent. All right. Any questions?
Eric?
Hi, thank you so much for the presentation. I do want to congratulate Hayley on such a professional presentation. She was impressive. I just share my experience. You know, this program, you said it started in 1982. I graduated from high school in 1981. I began abusing alcohol, just before that, in probably 1979 or 1980, and it lasted 30 years. And so to have a program like this, and have the opportunity to potentially save somebody 30 years of heartache and the wake that they leave behind with their substance abuse is really important. And I'm really impressed. And I just wish you all the success that's possible in the future, because if you can save, you know, some people from going through that, you can improve so many people's lives. So I just really appreciate your work. Thank you.
Thank you, Eric.
Are there any other questions? Dawn, Hayley, I want to thank you. I do have one quick question.
Sure.
I wondered, do the local chapters interact with other chapters either within their school district or across the county?
Yes, yes, they do. Yep. They'll sometimes what chapters will do is they'll host regional meetings or regional projects, and they'll come together to, you know, share ideas and to collaborate.
Okay, thank you. I see two more hands up, Melchiah and then John Paul.
I just wanted to thank you again, Hayley and Dawn, for a very, very extensive outlook or overview of what you provide. I'm really surprised because I've never heard of the organization or the work that you're doing. And I was really glad to see that you're in my city. I live in Pontiac.
Okay.
So I'm really, really glad to see that you're working with the students there. And I know it's nothing but good things ahead of you, Hayley, because you are phenomenal. So thank you so much for coming to speak with us tonight.
Thank
you.
John Paul.
Again, thank you for the presentation. Very impressive. It's nice to see. Actually, you guys are based out of my community here in Waterford, so that's pretty cool. And I see Waterford is on there.
Yes.
And a couple of questions. How many schools have the program? And then, and you may have mentioned that, but and then what has been the biggest challenge you faced in the era of COVID this past year, as far as still implementing the program effectively?
Okay. Statewide, we have about 150 schools that we work with. Oakland County, we're at about 45 that we are based in with our programs. The biggest challenge in COVID, I would say, is reaching the students because we are a school-based program. And when school was not in session or there wasn't a big connection with the teachers or the advisors with the students as they were trying to figure out the shift, being able to connect with them, because we had to go through the channels of the adults to still, you know, support the students. So I guess I would say that would be our biggest challenge, but that didn't last long. So that was nice because the teachers and stuff were looking for support. And then once they knew that we were able to transition quickly, they were more reaching out to us. So it wasn't a long challenge, but it was, you know, a little challenge.
Okay, thank you both so much for joining us, bringing another message that inspires. Hayley for presenting, amazing 11th grader that can do this. You're very well put together from that standpoint, well balanced, etc. And Dawn, thank you so much.
You're welcome. Thank you for having us.
Yes, thank you so much.
Next on the agenda is the acceptance of the meeting minutes. So these would be the committee of the whole meeting from January 11th, the acceptance of the CAC minutes of January 20th, the Oversight Board minutes of January 27th, as well as the RRAC minutes of January 7th. Is there a motion to approve those minutes?
This is Eric. Motion to approve.
Thank you, Eric. Is there a second?
This is Melchiah. I'll second that motion.
Thank you, Melchiah. Is there any discussion on this topic? Okay. All those in favor of acceptance of these meeting minutes, say aye.
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 Any opposed? Okay, the motion to accept carries. Next item on the agenda is the COVID-19 vaccine update. Deborah Glover, if you wouldn't mind, please. Thank you. Do we have technical difficulties?
You know what, Deborah, I can see that your mic is muted, so you might want to try and mute. There you go.
Okay,
There you are.
there we go.
There we
Hi,
go.
my name is Deborah Glover, and I am 62 years of age and disabled. I've lived in Pontiac, Michigan for approximately 8 years, 2 of which I spent at Hope Warming Center as a homeless guest. Also, I have done volunteer work at various organizations, particularly OCHN and Easter Seals Pontiac. I received both of my COVID-19 vaccinations because I was tired of sheltering in place and watching people on TV who was dying from the virus. People are dying from this disease or encountering lifelong effects like lung transplants. So after learning that the vaccine was safe and Dr. Fauci confirmed this, I decided to take the COVID-19 shot. When I took my first shot, I had a short cough for about 3 minutes, a sore arm, and I was sleepy. This lasted for 3 days, the soreness of the arm. At first, I didn't feel anything, so they had us wait 15 minutes to see if there was any side effects. I felt really good about this vaccination because even though it's only 94% effective, I can go into the grocery store or doctor's office and not worry as much about getting COVID. My second shot was even better than the first. I had a slight soreness of the arm about 3 days and felt great. Why is it important to take the vaccine? According to the CDC Center for Disease Control and Prevention, states that we cannot become ill with the COVID-19 because the shot is not filled with a live virus, but antibodies. Also, it can stop one from getting seriously ill from the virus, and we can stop spreading it to others. So thank you for your time.
Deborah, Ms. Glover, I want to thank you so much for sharing your story and your experience in getting the shots. I am hopeful that your message will be heard by others and that they too will step up and get on the list and get their shots. So thank you. Eric, do you have a comment or question?
Oh, I'm just so happy to hear that Deborah got her shot and that it went so well, and that I hope that she can continue to spread the message that people should be getting the vaccine. It's so important and an opportunity for us to finally quit, not have to shelter in place, etc., because it's causing so much, stress in a lot of houses throughout the community. And so just keep up the good work of spreading the news. Thanks a lot, Deborah.
Thank you.
Adam?
Yes, I just wanted to echo what people have said. Thank you, Deborah, for sharing your experience and background, as well as the your experience with the vaccine as well. And I'm glad to hear that it was such a positive experience for you. Thank you.
You're welcome.
Judy?
Thank you. Deborah, You did a marvelous job sharing your experience. I know a lot of people will benefit from your story, and this could also easily be a story that inspires hope in a much grander way than we might actually know immediately, but certainly as months come forward. So thanks again. Really appreciate your effort.
Thank you.
Again, thank you for coming on our board meeting and sharing your story. It certainly inspired me, and I don't feel like I'm alone today in getting a shot. Next up on the agenda are our various chair reports. So I'll start with the board chair's report for February 2021. I'm going to cover 4 items. I probably won't be this long in future committee meetings, but I'll cover the executive committee. The executive committee is made up of the chair, that's myself, our vice chair, Dr. Sarah Guadalupe, our secretary, Adam Furman, along with the chairs for policy and for business operations committees. And so that would be Dr. Sarah Guadalupe and Erica Lindemeyer. So the board meets roughly once a month at noon on the first Wednesday of the month. And we do that along with our CEO, Dana, our COO, Nicole, and other invited leadership or staff. As you'll note, starting at this board meeting, the chairs of the policy and business ops, as well as myself, will be reporting out what's transpired at these meetings. So this has changed from what we've done in the past. The point of this is to promote greater transparency and greater engagement by our board to the public, to those that we serve. So this is not unlike our board members, Melkaya, John Paul, Eric, or myself, that have done this where we've reported out as board liaisons to the CAC, the RRAC, SUD Oversight committee meetings. So that's a change. So at this last month's executive committee meeting that was held at noon on Wednesday the 3rd, we met and discussed the upcoming schedules for various meetings like the board meeting, the committee, the whole, as well as our study sessions, and talked about the topics and the reorganization of the meetings. At our upcoming study sessions, because we have a fair number of people that are relatively new, or we will have new board members, we're planning on some deep dive sessions, some that are related to board orientation and the tools like Boardable and things like that, and the analytics and the technology, and some that are specifically related to our bylaws, our policies, and our practices, and what goes on behind the scenes. So earlier this fiscal year, we did our recipient rights training, the annual recipients rights training. We covered conflict of interest and ethical behavior. So the second item on my topic list is the CMHA, the Community Mental Health Association's Winter Conference. So that happened this past week. Traditionally, it's held in Kalamazoo in February. This year it was virtual, like everything else seems to be. So what was pretty amazing was attended by 426 people, I think, was the last count I saw. We had 7 board members that attended, along with Dana, our executive, and leadership and staff. What's pretty amazing about these conferences, it's a mix of education, experience, mentoring, and getting together. So there were 28 different topics at these sessions. So being that it was virtual, I really missed the opportunity to interact with other boards, members, and staff, or other attendees from across the state. I happen to believe that when we have these conferences, it's a great opportunity to meet people, but also build tighter, stronger relationships, because we don't, even though we're Oakland, we don't operate in a vacuum. We don't operate alone. So these conferences help us enhance our perspectives, gain knowledge and insights into what is or what perhaps might be in the future, but as well as the future, how we might be supporting those we serve. So yes, it gives us a chance to share, but it also gives us an opportunity to see and learn what others did, how they do it, what worked and what didn't. So I found that the state's keynote and the what's happening in Lansing very interesting, because I never know what's really going to come out of the state or the feds. or where they're heading or when. I just know there's always change, so we have to keep an eye on it. Sort of like radar. It's coming, but we don't know when or how fast or what its impact is. I also attended and viewed a number of breakout sessions. I think I looked at probably 15 or 16 of them. I still have more that I can review. But I found 3 that are worth mentioning given our mission, which is to inspire hope, empower people, and strengthen communities. So I found 3. The first one was the session on engaging with Arab and Chaldean American families, the culture and competency versus the culture and humility. So, when I look at everything, and this isn't a surprise, I look at the numbers, I look at where we're serving, how we're serving, who we're serving, from a geographic and demographics perspective. And I think that we don't serve as many people as we should across the county. And I think that, so from a geography perspective, and I think that also that there are a fair number of folks in different demographics. So whether that's race or religion or other aspects that are just being underserved by OCHN. It's not that we're turning them away, but I think we need to do more to evolve our efforts and our approaches to reach and entice them to utilize the services and supports we provide so well to others across the county. So I know this is a focus for Diana and the leadership team in OCHN, and I know Christine Burke, you've got a lot of, we've got some items on the agenda tonight that are related to that. So, so that's where I saw that particular session of interest. There was a session on disability pride and assistive technology. And I was pretty amazed that there's so many different ways and tools that help people empower through self-sufficiency. And as well, while I heard a little bit about it, I didn't really understand what the Michigan Assistive Technology Program was. So it was pretty interesting to me. And then the last one was a session on innovative responses to COVID-19, the impact on mental health care. So most of you know that I am a strong advocate of using telehealth for lots of reasons. We've been slow to adopt it, at least in my humble opinion, in comparison to Detroit, Wayne, Macomb, and others across the state. However, I think COVID-19 has forced us, along with our core providers and direct providers and other partners, to leverage a lot of different group and interactive technologies. So not just for hospital triage, but also for a lot of our day-to-day activities from assessments, care planning, and management. So because of COVID and this trial by fire, if you will, it's really allowed us to, adapt in a lot of different ways. So I'm really proud of our successes, but also even in those failures where we tried to do things that just haven't worked out as well as we have. I'm just hoping that as we come out of COVID, that we will continue to leverage more of the telehealth and more of the technologies to not just operate more effectively or efficiently, but to save time and engage with folks on a much faster basis. The third item that I want to talk about is the OMA, the Open Meetings Act. The state has continued to evolve the Open Meetings Act. Currently, virtual meetings are expected to continue throughout March. Perhaps it will change again and continue on a little bit later, but it's up to the legislature to make those changes, and they continue to do that. And I know we will keep you up to date on what's changing or what's not, whether that's through Miss Ali from Kalana or from Dana or from other venues. So, but as you've heard tonight during our board attendance, when we did the roll call, we respond. We also say where we're now located. That's required as part of the OMA, the Open Meetings Act. When the emergency ends, and if persons are not able to be here physically on site at the boardroom, they'll still have an out for either healthcare or military reasons, as long as they cite that that's the reason that they're still virtual. And the last topic I want to cover, and I'll do it very briefly because I've spoken much longer than I wanted to, has to do with the vaccine registration. You heard tonight from Deborah Glover about her experience and about her trust in doing this and her wanting to to still be socially, distanced, but know that she can go out. Like most of us are. It's been a year. So my suggestion to you is register. Register at as many places as you can, whether that's with Honor, our trusted FQHC partner, register with the county, register at Ascension, at Beaumont, at Ford, at McLaren, at the various pharmacies, at Myers, wherever you might get a flu shot. Call them, find out if you can register and get on their lists. Because sooner or later, someone's going to say, hey, it's your turn. And you won't, if you're only registered in one place, you've only got one place that's going to reach out to you and say it's your turn. But if you've registered to a half dozen places, then maybe you'll get your turn sooner. So with that, if you get an appointment, keep your appointment. Before you leave from that first shot, get your second appointment for the second shot, and then don't miss that. All right? And continue to wear your mask and continue to maintain your social distancing. It's been 12 months since we've heard about COVID, and it's 11 months since we've been locked in or sheltered in place. It's not easy. We know it. But it beats the alternatives. It beats getting sick. So thank you. All right. Next up is Policy Management Committee report by Dr. Sarah Guadalupe.
Thank you, Jonathan.
Welcome.
So as Jonathan mentioned, this will be the first board meeting in which we will pull apart the two different areas that we discuss in the committee of the whole. And so I will be focusing on the policy components. And so during our committee of the whole meeting on February 7th, there was two policy issues that were brought forward. The first being a presentation from Christine Burke, our Director of Communications and Community Outreach. And Christine focused on communications and community outreach, annual plan and quarterly update. This was a time for Christine to review outcomes for and discussion about the communication department's advocacy, awareness, education, and outreach efforts during the first quarter of the fiscal year. One of the goals for this presentation was to focus on community education, so enhancing community awareness about OCHN services and branding by showcasing OCHN's accomplishments, work culture, and network. Community education and outreach are the foundation for advocacy. The objectives are to communicate news about OCHN through print and electronic media and events. Quarterly status, so the opened email rates is about 36% on the average. Industry average is approximately 17%. Newsletters have a 29% open rate, so 345 recipients, and mailed out 15,181 Stepping Stones newsletters. With social media, OCHN has approximately 4,000 followers, and media outreach, 40 news articles and 12 press releases. One of the other topic areas was the goal of community education, so ensuring members of the faith-based community are aware of OCHN services. Being electronic faith-based email list has increased from 250 to 420. Postcards were mailed to more than 700 organizations requesting they subscribe to email list, and faith-based routable schedule on March 18th, 2021. The third discussion point, again, focusing on community education, is to build a more user-friendly website to be able to identify a new web provider, and an RFP to identify a new website host and designer per the CEO's request, which was launched in November 2020. So there was review and discussion at committee of the whole on this topic. And then the second policy topic was presented by Stephanie Wilson, our Director of Clinical Practice. And the topic of Stephanie's presentation was the clinical practice team, the annual plan quarterly update. So the overall message was to ensure use of evidence-based practices or evidence-based and best practices, person-centered planning, as well as utilization management and review of services through annual planning initiatives. There were three goal areas that Stephanie touched on. So the first being health and wellness, the implementation of behavioral health homes within our provider network and with community partners. OCHN launched the behavioral health home on 10/1 of 2020 with 6 core provider partners signing on to participate in fiscal year 21. 3 partners were actively enrolling individuals in Q1, and as of 2/8/21, there were 232 individuals currently enrolled in Oakland County. Second topic area was technology and innovation in health and wellness, being a continued implementation of complex case management, care coordination, and use of HIDIS measures. HIDIS measure 304 related to diabetes screening works towards a goal of 80%. The current measure as of November 2020 was 74%. And nurse case managers coordinated with 8 Medicaid health plans, along with our provider network, regarding 32 individuals receiving services. And then lastly, services and supports continued suicide prevention efforts across OCHN network. So all OCHN staff required training starting in fiscal year 21, the implementation of clinical pathway to suicide care, ongoing internal zero suicide work group, and start of external zero suicide work group with OCHN providers in Q1 of fiscal year 21, and continued participation in the state suicide prevention commission. So those were our policy areas that were discussed during the committee of the whole synopsis. Thank you.
Thank you, Sarah. Eric Lindemeyer, our chair for business operations.
Thank you, Jonathan. There's 2 areas that I'm going to discuss. One is the financial trends that we had a presentation on from Anya, and then the second one is will be an action item on an advertising budget that I'll go over. But the first thing that I'd like to say is that, you know, during our committee of the whole meetings, Anya provides the board and the community with terrific details in how the finances of the organization are being run, and I think that the community has been incredibly well served by Anya's detail and her explanations in our committee of the whole meetings. With that, we're going to discuss a little bit about the December 2020 financial trends and kind of compare how they are now. OCHN is reporting a comparative fiscal year 20 totals along with the first 3 months of fiscal year 21. The totals for fiscal year 20 will continue to be updated as we complete our year-end process and finalize this year's audit. The board agreed to the previously monthly financials presented on January 19th. Our good financial oversight allows transparency in financial position and trending to ensure financial resources are available for all of our persons served. There's 3 points to note. Anya noted revenue and eligibility enrollees has increased from previous years. It's also showing cash investment as an increase, primarily due to the direct care wage increase. The second point in the comparison reports shows that liabilities decreased and net position is showing an increase with assets staying the same. The results showing the net position has improved. Reports showing Medicaid revenue as an increase, and we noted that there's a slight adjustment to capitation rates. The third point is a expense comparison through December 31st of 2020. It shows a decrease in the administration due to the reorganizing of the general ledger and provider network expenses also decreased due to the cost reimbursement models. However, Anya anticipates for this to increase as providers move off of the cost-based payment model. Is there any discussion from the board on that issue? Hearing none. The second item was presented by Christine Burke, and we discussed the local network advertising contracts that will need board action on it. There are two contracts being proposed that total $101,000 for major network advertising. One contract would be with WDIV Channel 4 for $51,000. The second one would be for ABC Channel 7 and Channel 20, and that's worth $50,000. It's a 6-month contract for both, and there's a total of 160 spots available. The advertising goal is to improve connection of people to services. The second goal is to enhance OCHN's branding and awareness. And the third goal is to position OCHN as a leading healthcare provider for future privatization discussion. Something else that I noted that I thought was important is we get to control the content once the commercials are produced, and we can use those in social media campaigns and other campaigns if I understand the presentation properly. And so that's an item that is going to need board approval. Is that something, Jonathan, that you want to put forth and take a vote on?
You're talking about the approval of the two contracts?
Yes.
That's the next item on the agenda, actually, after your report.
Oh, okay. So I'm done with my report. Thanks a lot.
All right. Thank you both very much for presenting your reports. We'll move on to the next item on the agenda, which is an action item. It's for the approval of the WDIV and WXYZ television contracts. Is there a motion to approve these two contracts totaling approximately $106,000?
This is Steve. I make a motion that we approve the two contracts.
Thank you. Is there a second?
This is Hadass. I second it.
Thank you, Hadass. So motion by, is there any discussion on this, on the approval of these contracts, on the motion?
This is Hadass too. I
Yes.
have some questions. I apologize that I don't know the answers to them. So the first is just in compare, and I completely support this, but just comparing to last year, what's the price difference of what we invested last year to this year, if anyone knows?
So I can answer that, Hadass. Traditionally, our advertising budget is approximately $140,000. A majority of that money is used from SUD funding. Some of it comes through grants that we receive throughout the year. So we anticipate these grants and we budget for them accordingly. If they come through, then we use the dollars. And so this would be an additional 100,000 on top of the 140.
Which I think is great. So I just wanted to make sure that was clear. And then the other thing is the cost of actually creating the commercials. Is that included in this, or is that going to be an additional cost?
No, that is included in this. The other benefit of going with both organizations and with technology is that in addition to the commercials, they will keep us on their network feeds, on their websites, and then they will track and monitor analytics for us and report back.
Fabulous. And will they also do some PSAs for us, or they do that automatically?
No, the public service announcements are not part of the contract, but there is consideration and conversation. For example, if a content expert is needed for a news story, that once that relationship is cultivated, then we are more likely to be consulted with as a content expert or a subject matter expert on various topics related to mental health and substance use.
Got it. Okay, great. Thank you.
Are there any other questions?
Yeah, this is Steve. Another thing that Christine mentioned last time is that after the different ads have reached their lifespan, they aren't the property of the stations. They become our property, and we can keep them in our archives and use them in the future on our own off the TV. So I think that's great.
Fabulous.
All right. If there are no more questions, I'll ask for a roll call vote.
Sure. Ms. Bernard,
Yes.
Ms. Namie Dyer, Ms. Root,
Yes.
Dr. Hans,
Yes.
Dr. Taub,
Yes.
Ms. Summers,
Yes.
Ms. Newman,
Yes.
Mr. Torres,
Yes.
Mr. Lindemere, Mr. Lindemere, I don't know if your mic is off.
I think he had a really bad connection. He had told me earlier, so he may have fallen out through the bad connection.
Okay. Dr. Guadalupe,
Yes.
Mr. Furman,
Yes, and Adam Furman is joining from Troy, Michigan tonight. Thank you.
thank you, Adam. Mr. Landsman,
I vote yes. So it sounds like this motion for these two contracts has been approved. Thank you. Next up is the consent agenda. And so the consent agenda this month includes the approval of the board meeting minutes from January 19th, and also the approval of the RRAC recommendation for renewing Liz Janovitz, Elizabeth, I'm sorry. I know where's Liz, but Elizabeth Janovitz for a second term. Is there a motion to approve the consent agenda?
Motion to approve the consent agenda?
Thank you, Adam. Is there a second?
I'll second it, John Paul.
Thank you, John Paul. All right, let's do another roll call vote.
okay. Ms. Bernard,
Sorry, yes, I was muted.
Oh, okay.
Can you hear me now?
Yep, we can. Thank you.
Yes.
Ms. Namie Dyer, Ms. Root,
Yes.
Dr. Hans,
Yes.
Dr. Taub,
Yes.
Ms. Summers,
Yes.
Ms. Newman,
Yes.
Mr. Torres,
Yes.
Mr. Lindemere,
Yes.
Dr. Guadalupe,
Yes.
Mr. Furman,
Yes.
Mr. Landsman.
Yes. So the motion for the consent agenda has been approved, and Elizabeth has been renewed for a second term. All right, next item on the agenda is other business.
To the board, this is Dana Lassby. I just wanted to recognize Black History Month, and we wanted to share with you a video that we shared during our very short video during our last staff meeting. So we wanted to share this in recognition of Black history. And so please enjoy.
Emily, I think we're still seeing the consent agenda item.
I
Yeah,
see the video, Jonathan. Are you guys not seeing the video?
no, I don't see the video either. This is John Paul.
I'm not. No,
I
we are
see.
not.
I
This
can
is-
see it, but I can't hear it.
Right, I can see it, but it's not moving. Somebody
I don't
All
see
right.
it or hear it.
I think the quick
I
fix
don't
is
see it.
to, I think the quick fix is to unshare and then reshare.
Do you want to unshare and then reshare the video?
Yep. Give me
Okay.
1 second here.
All right. It sounds like
Just-
some of us can see and hear it, and some of us cannot.
Yeah, that's what happens sometimes with these technologies. And it is worth seeing. And I haven't seen it yet, but I'll pre-critique.
Can everybody see the slide with the video on it now?
Yes.
Yeah.
Okay.
Yes.
Okay.
I can see it.
All righty.
There it is.
There it is.
Hello. Black History Month is a commemoration, vocab word, for Black activists, another vocab word, who took their time out to go fight for what they feel is right. Like Martin Luther King had a speech that violence is not the answer and no segregation. We celebrate Black people that helped us change history. It reminds us to be strong, even in politics. What matters is what's inside of you and how you act to other people.
Doesn't matter if you're Black, if you're white, you should always celebrate it because you know the struggles Black leaders went through in order for you to be here right now. Even though we may have the different skin color, we're still the same type of people, no matter what.
And a lot of people, they don't see me for who I am. They see my outside appearance, but they don't see what I have on the inside.
It's very hard to grow up knowing that you're Black and you have a lot of personal prejudice against you.
I see it on the TV and I'm like, is that gonna happen to my brother? Is that gonna happen to my dad? And I always have that in the back of my mind every time that I'm home and they're not home.
Black history is important to me because I have to remember where I came from and I have to remember who came before me.
Because you have to look at the things that Martin Luther King Jr., Rosa Parks, and Malcolm X did for us Black people, so people can't treat us unfairly because they think some type of belief. Because we are all people, and you need to stand up for our rights. There's still discrimination. There's still discrimination in all parts of the world, in all parts of the United States. We should still fight for what we believe in. We should still fight for getting what's right.
Wow. I feel
Very
blessed.
nice.
We had 3 different items that inspire. So, all right. Committee reports. The first item on this list is the recipient rights. John Paul, if you'd like to report out.
Yes, thank you. We had a Recipients' Rights Advisory Committee meeting on February 4th at 4 p.m. We received the presentation from Ms. Judith Summers regarding how to become a board member, the processes of becoming a board member, and the rewards. We received a report from the Rights and Advocacy Director, Ms. Suter, and the Rights Manager update from Ms. Jean. I'm sorry if I'm pronouncing your name wrong. Pathfinder. Then we also received a presentation from myself, John Paul Torres, on the dynamics of probate court, including guardianships, conservatorships for adults and for children, the mental health courts processes for petitions, and the various specialty courts that exist within the court systems, including mental health courts, drug treatment courts, family drug treatment courts, and veterans courts. We also received an overview on mental health first aid advisors from Ashley Barber. And in mental health first aid is considered a person who receives aid while they're in crisis, so it's the initial help that is offered. Reasons to become a mental health first aider include being able to identify risk factors and warning signs, the 5-step action plan to help someone who is developing problems or is in crisis. And when mental health first aid can help, it's an early intervention process, which can be very helpful in the overall treatment process. The Recipients Rights Advisory Committee discussed the reappointment of Elizabeth Janovitz, whom we just reappointed for a second third-year term. We voted for the chair of the Recipients Rights Advisory Committee to be Nancy Ristich. And we received information on site review reports for the 2021 year. 85 out of 45, or 85 out of 430 sites have been reviewed or completed. It's being done virtually in a COVID world. This is my report as submitted respectfully by myself, John Paul Torres. Thank you.
Thank you, John Paul. Next item would be the CAC. Melkaya, if you would report out, please.
Thank you, Mr. Landsman. Meeting was called to order by the chair, Lois Schulman. Introductions were given by members and guests. December's minutes were approved. Public comment was given. I had the privilege of introducing Ms. Judy Summers to the CAC. Ms. Summers announced her upcoming retirement from the Board of Directors effective March 2021. She wanted to encourage members to consider applying for a seat on the board. Ms. Summers emphasized the need for the voices of people with lived experience to be a part of the decision-making process at OCHN. In closing, she offered her support to anyone considering accepting her challenge. She gave out her contact information and the website to Oakland County where they will apply. This, as another part of public comment, CAC members also took the time to compliment Ms. Valerie Spavin on how well she took care of the paperwork for the meetings. Next, there was a very enthusiastic welcome back for Mike Daly, who had been away on medical. He looks well and he was truly missed. Members assured him that the CAC was in good hands while he was away with Mark Jones and Valerie. Christine Burke was in attendance to give Dana's director's report for January and in her absence, and to give a communications department update. There was a very extensive discussion about the COVID-19 vaccines. There have been several sessions with the staff of Honor Community Health to help dispel the myths about the vaccines and encourage everyone to take the vaccine, even though they understand the reluctance on the part of many people. The sessions were recorded and are available for anyone who would like to review them on the OCHN website. She also gave an update about the iPads that were distributed to people served by our network. The communication staff are collecting data to see how people are utilizing the tablets and whether or not there's impact on their quality of life for the IT staff. Christine also spoke about the current efforts that were being made with the Diversity, Equity, and Inclusion Work Group within OCHN. And she also spoke about the new media campaign that's being launched to help get the word out in the community about OCHN, who we are, and what services we're here to provide. Committee reports were given, and I gave my board update. The next meeting will be held Wednesday, February 17th at 10 a.m. Respectfully submitted, Melkaya Newman.
Thank you so much, Melkaya, Ms. Newman. Last board report, or last committee report would be for substance use and the Oversight Policy Board. Eric?
Thank you, Jonathan. Shelley Tabb called our meeting to order at 1 o'clock on I think it was January 27th. And unfortunately, Commissioner Shelley Taub had decided not to run for another term as our chair. And I know that we had recognized her service on our board meeting on January 19th, but we should just thank her again for the great work that she did on that committee. She was more than just a participant on the committee, she was a real leader. We were able to elect a new board chair that I was happy to nominate. Her name is Kelly Flynn, and I've gotten to know Kelly over the past 6 months or so, and she'll do a great job. The next item is that OCHN has assumed responsibility to fund, monitor, and deliver substance use disorder services to individuals under supervision of the Michigan Department of Corrections. Several OCHN substance use providers have experience supporting individuals with involvement in the justice system. And one thing that we know for sure is that when people come out of the justice system, they need recovery coaches, and they need to be connected to someone. That greatly drives up the success of people in their treatment. Sherry Cook gave a report on treatment. OCHN is sponsoring a trauma-informed care training for substance use professionals. There was one session that was scheduled last week on February 11th, but there's another one that's scheduled on February 18th if anyone is interested, and there were two sessions were scheduled just to allow for flexibility for people that couldn't attend one of the sessions. There's been a provider relocation. Therapeutics LLC is moving from Wixom to a larger site in Walled Lake, and will be opening a site in Pontiac soon. And so that's great to hear. Therapeutics LLC provides medication-assisted treatment and case management services. The expansion will allow them people to have additional access to treatment. Megan Phillips gave a report on access services. One of the department goals for access, which also ties into our annual plan, is to meet all ongoing requirements to successfully maintain compliance with the National Committee on Quality Assurance and their accreditation standards. The good thing to know is that using our call center, we can monitor the two standards that Access must meet each quarter, answering calls on an average within 30 seconds and having a call abandonment rate of less than 5%, which we know is very important. Rachel Rhodes gave a presentation on prevention. And then the last issue that I would mention is something that we talked about under old business, and that we could use some help from board members in the community. There are currently 4 open positions on the Oversight Policy Board. Representation for the open positions would preferably include, but not limited to, persons with ties in the faith-based community, with a prevention background, an individual or a family member or close personal friend of an individual in active recovery who receives services in the network. It would be great to have additional 4 people on the board for those open positions. And if anyone knows of someone that would be good for one of those positions, the application is available on the OCHN website. And with that, that concludes my report. Thanks.
Thank you, Eric. I just want to say before we move on to the next topic, there are openings also, I believe, on the RRAC on recipient rights. And so feel free to reach out the public to reach out to our organization and ask how to apply, as well as to the SUD Oversight Policy Committee. Next item on the agenda is the director's report. Dana?
Good evening again, everyone. And I do want to thank Don Flood and Hayley, as well as Deborah Glover, for those wonderful stories that inspire hope. And I also have to thank Judy Summers for having the idea of using or asking someone who has experienced the COVID vaccine to speak and inspire others to have and take the vaccine. So I think it's important that we continue. I think in 2020, we know it was a year of advocacy and making sure that people knew about the resources that were available. And as we move forward in my report, I do want to focus on some priorities that we need to continue in 2021. And then the other thing is really focus on how we position OCHN to be responsive to community crisis. And I think we've demonstrated that we can do that through our work with the system and with the people we serve in 2020. And again, I think we have to continue our work. There's a lot more work to do. So with that, I'll start to talk about the priorities. The first being, of course, access to vaccinations. And we are doing that through a collaboration with Honors Health and the Oakland County Health Department. So we're pleased to update this board and the community that we were approached by Honors, and we will be having a COVID vaccine clinic. And we're scheduled to have that on Friday and Saturday. We've already taken a list of people who are interested in getting the vaccine using the priority listing criteria. And so as of today, we had over 1,500 people who have signed up to get the COVID vaccine, which is really good. But the sad part about it, we hope we could give everybody a vaccine that wanted one, but we know there are some limitations in terms of supply and the availability of the vaccine. So we'll continue to work with Honors so that in the event that they have additional vaccine to distribute, we will be able to partner with them and make sure that as many people that want it can also get it. So I'm happy to announce that, and I have to thank Christine and Nicole Lawson for all their hard work in setting everything up, as well as the other staff and team members for really setting this up and making this happen for the community, and especially for the people we serve. The next issue, which is resurfacing, of course, is system redesign and system transformation. And we now know that there are many discussions that are going on with the health plans as well as MDHHS leadership. And they're looking at a vision for the future, especially as it relates to specialty mental health services. So although this topic sort of lay dormant for a minute and boilerplate language 298 went away, as it talks about now, system redesign. So we're positioning ourselves to be sure that we're part of the public mental health system and not a for-profit Medicaid health plan. So we have to continue to talk about what the need is for the community as it relates to what public mental health services do for the community and the people we serve. So we have to remain vigilant because those threats are not going away. And we also have to advocate to reserve those financial resources we get to support the public system. So legislators need to be aware of the differences in priorities, and they also need to know what it is that we do in terms of being the safety net for the community as opposed to looking at profit and control. So those are some things that I will ask for your support on when you go and attend the meetings with the association, and then also with other legislators and entities that are interested in what we do. So we've been asked questions from the news and other people about what we see as the goal of the public mental health system. And so we're happy to provide facts and information about all the great things that we do in our community. The next thing that I'll ask you to focus on is the direct support professionals, also referred to as direct care workers, and advocating for the $2 wage increase. And we know that our governor has put in language in the budget to make sure that that $2 wage increase happens. What we don't hear about is how that we make it stay. So if she put it in the budget, it will be a year-to-year item in the budget that could pass or fail. if we change it in the Medicaid laws and rules, it's something that we can maintain. So I'll have more information on that you could use to help in terms of advocating for those $2. But for now, it really is those focus items that we need to continue to talk about and share information about what it is that OCHN does, being responsive to the community, especially in times of crisis, accessing those resources and making sure that people are aware of the quality behavioral health services that are available in Oakland County. So the other thing I would like to highlight is just a report of numbers, and I like to always include the number of people that we are currently serving. In January, as of January, it was 17,196 people. So you'll see the breakdown in my report, because again, I think the numbers are important, even though we need to focus on the services and the access of services. And we know we had to shift into telehealth. Now we see more of our providers opening up for face-to-face services. So it's important to look at the numbers and look at the people that we are serving and see that there are increased need in mental health. I think there's not a day that goes by in the news or in television where it talks about the increased need for behavioral health, substance abuse, mental health treatment to support people in need or in response to the COVID pandemic. So again, just to reiterate what we talked about earlier in terms of the COVID vaccine, we know as of today, we have a report that tells us the number of people that have been tested and that have tested positive. And I'm happy to say that number, like the rest of the state, is going down. But we also have a number of people that we support who've received the single dose of the vaccine. As of today is 676. Those who have received 2 vaccinations or the second dosage is 183. So we had a total of 859 vaccines administered. So we want to do better. I mean, that's a good start, but we want to do a lot better. And that's what the clinics will do. And so the criteria that was developed and what we communicated to the county was that people who receive our services living in a licensed or non-licensed residential setting, direct care professionals, of course, family members in a caregiver role for an adult, Oakland County healthcare workers providing face-to-face services in the public mental health system. Again, we're planning to have our first clinic this Friday. We already have set up appointments for people, and I will end here and open it up for any questions you may have.
Any questions? Adam.
You know what? I'm muted. There we go. Yeah, Dana, I just wanted to thank you for talking about the direct care wage increase as it relates to the Medicaid language going forward. I think that's an important nuance that the public should know about in addition to the yearly budget discussion. So that's great that we've got that clarification going forward.
Thank you. Yeah, I think most of us assumed that once she made the decision, Governor Whitmer made the decision to approve the $2, that it would be a permanent thing, but it's not a permanent thing if it's not included in the Medicaid language. And it's something that could come and go every year with the approval of the budget.
Thank you.
Ms. Newman.
Thank you, Mr. Lansman. Dana, it's not really a question, it's more of a comment. We have so many new legislators that just started. So this big push to go back to the, take the money and go back to the Medicaid health plans, we know it's coming from established legislators that are already there, whose minds are made up. And I don't know, I really feel like we need to do a better job talking about the stigma that's associated with a lot of these decisions that are being made. Because if you're a legislator and you don't understand our system, don't understand the people that work for the system, like the direct professionals, then you do make decisions that are not in our best interest, and they don't recognize that they're doing that. So I'm frustrated, a little frustrated with this, because we know that the Medicaid health plans are pushing a lot of money towards these legislators, which is another reason why they're supporting it. Don't give us the platitudes. You're getting paid. You're getting paid. So we can advocate, but the ones, that their minds are made up, this is what they're going to do, come hell or high water. I don't know what we can do to change that. But we really do need to speak more to the negative stereotypes that is pushing this type of legislation out of Lansing.
Yeah, I think they're comparing apples to apples. And when you look at the public mental health system and the array of services that we provide, it's not comparable to a private or a commercial, or even the Medicaid health plans and what they provide. It's more of a managed control when we're looking for people and looking at what their needs are and basing the services around need. And so I agree with you. We've been talking a lot with the newer legislators, but I think you're right. It is individuals that have been around quite a long time and their minds are pretty made up. But I think we just have to keep meeting and educating and working together to figure out new ways to make sure that we're being heard. And I also think there's a big push with celebrities now in using their platform to talk about mental health. But again, I don't think people understand there's a difference between people who can pay for services versus people who have limited resources. And it's not just mental health and behavioral health, it's whole health in terms of where they live, how they get around in terms of transportation, what kind of supports they have in the community, even spiritual supports and things of that nature, where their next meal is going to come from. So when we look at it, we're looking at everything the person needs and how do we help them to access those resources. Whereas when you talk about the Medicaid health plans, they're talking specifically about healthcare. And not that that's a small thing, but we look at whole health. We look at the well-being and the person really having the ability to live their best life with the services and supports that we can provide.
Thank you. John Paul?
Thank you. I have a question with regard to the partnership for the vaccines. You had said that we're working with Honor Community Health, correct? And then the Oakland County Health Department. And I believe you said it was 1,500 people who are on the list. Now, is that open? Are we opening that to anybody who qualifies, like in that 1A, 1B category, or is it specific to those within our network that qualify?
It's specific to people within our network that qualify. So what we did is we sent out communication to those individuals and asked them if they would be interested in receiving the vaccine. So it does include the workforce that works with the service provider or in the residential settings. So we extended it to those individuals, but we also wanted to make sure that people we specifically serve had first opportunity to get the vaccine through us, because it will be at the Troy location. It'll be at our Troy building. So we're making arrangements to make sure that the individuals have appointments, they don't have an extended wait, make sure they're comfortable. And of course, everybody has a fear. So we want to make sure everything is in the setting that they need so it's successful, so that they don't have a lot of anxiety and fears that we know most of us have about getting the vaccine.
And you said it included their family that are caregivers, correct?
Yes, it did. It does.
Thank you.
Mm-hmm.
Judy?
Thank you, Jonathan. I just wondered regarding the $2 an hour wage increase, do you think that there's any impact on focus with the merger that occurred to create MDHHS to further the understanding of the need of this? Or would the prior structure maybe have been more a softer landing for that argument?
Well, actually, I don't. I think that once we worked with MDHHS and with the transitional leadership, they were really on the same page. I think that one of the items that came out prior to the budget did not include direct care workers. It did include nursing home staff and people who worked in those settings, but it did not talk about people who worked in behavioral health as direct care or direct service professionals. So once we got the information through, we saw it included, and we were notified by Capital Services that it would be something that was on the governor's desk for consideration. So we also worked with the leadership at the state level, MDHS, Al Jansen, and even Liz Hertel in terms of making sure that she had the information. So I think all of that helped in terms of just making sure they understood that if it just left the language at nursing home work, people who worked in the nursing homes, it would not automatically include the people who serve the people we support. So we made sure that that language was clear so that it would include, and the governor did include it in her budget report, specifically those who work in behavioral health. So that's important.
It's very important. And I just wondered if there's a way to, for advocacy to really focus in on the understanding that the direct support professional is on par with healthcare workers in other settings. Anything we can do, anything we can include language-wise when we, advocate to our legislators?
I think it's multiple avenues that we can pursue. One is through schools doing a certification program, because when you look at nursing aides, for example, a lot of them go through a certified program. And so we have training programs for our direct service professionals, but nothing that would give them a certification. So I think we can pursue it in that way. We can work with community colleges or other training programs where direct service professionals could become certified. That's one way. The other way is really looking at what if we did not have direct support or direct service professionals? What would happen to the people we serve? Many individuals are able to live independently with the support of the direct service professionals. So I think we need to talk about that and talk about what a vital role they play in the lives of people we serve and support. So that's the other thing, really clearly defining what their roles are and what they mean. And then the other piece of it is the billing and being able to bill for the services that they provide and making sure that we're documenting based on the need of the community, how important and how critical direct service professionals are. Many of them work 24/7. It's like a hospital setting that an individual may not ever be able to live on their own alone because of safety and health reasons. So we just have to, I think, communicate that, really stress the importance of education and some sort of certification program, but also why we need those pay raises and those pay increases in their regular wage is because we're competing. We're competing with Amazon. We're competing with Taco Bell and things of that nature. And not to knock those jobs, but those are jobs. Many people need a career path. And maybe we look at developing a career path for direct service professionals to lead into some kind of management role to really be a vital part of the workforce, because we know we need them. And we even know now when we have individuals who need additional support, either long-term or short-term, it takes a lot to find somebody that really fits the needs of that individual. And that individual has choice. So you can find the best trained person in the world, and if that individual doesn't choose to work with that person, then we have to take those things into consideration.
I completely agree. I think that understanding a lot of the elements you identified, plus the fact that how high a value we place on the people we serve, and that they deserve the proper and compatible support that the system should provide.
Okay. Thank you. Are there any other board questions or comments for Dana? All right, so move on to the next item on the agenda, and that's the second public comment. Do we have any? Go ahead, Christine.
No, we do not have any public comment this evening for the second public comment opportunity.
All right, thank you. So next is our last item on the agenda, which is board comments. We would like to go through the roll call and ask if any board members have comment they'd like to provide.
Sure. Ms. Bernard. I'm not sure if you're on mute.
Who did you ask for?
Mute.
Board comment.
Yep.
Oh, I'm sorry. I think I was unmuting as you were asking.
Oh,
I
okay.
just want to thank everybody. I thought it was a great board meeting and really, really worthwhile. And just thank you, everyone. So that's all I have to say.
Miss Root.
No comment, thank you.
Dr. Hans.
Yes, another great meeting. The stories of inspiration were tremendous today, really moving. One of the things that I had mentioned, I think a couple meetings ago, was the CPR training for direct care professionals. I don't know if there is any follow-up on that, but one of the resources could be American Health or American Heart Association, and they do training to civilians as well as professionals, and that may be a resource. I understand that it's difficult doing the virtual, but I'm sure they may have some resources. So maybe that's something that can be looked into. The other thing I had was wondering about was that in the future, if we could have a presentation on mental health first aid and how it is being done in the public school system, because I understand that children currently are going through a lot of stress, and anecdotally, I hear some worrisome incidents. So that is something that I would be interested in. Thank you.
Miss Summers.
Thank you, Sheila. I just want to say I appreciate all of the information and energy that was included in our presentations tonight. I was particularly struck by the wisdom of the young people that were in the video that we viewed to recognize Black History Month. It kind of made me a believer in reincarnation because they sounded like such old souls. So this was a great meeting. I hope you all stay safe and well, and I wish you good night. It's probably a good night not to have to drive home.
Thank you, Judy.
Miss Newman.
Thank you. I enjoyed all of the presentations that were given. I was a little surprised by the change with the committee reports, but I guess we'll get used to that. And I also appreciate Dana's report. And I really want to just give a shout out to the staff. Anytime that I've had a particular need, they've always been very responsive, and I want to make sure that I say publicly that we have some wonderful people that work for OCHN and take care of the needs of the people that we serve as well as the board. And I just wanted to make sure that I gave that shout out. I don't want to start calling names because I don't want to leave anybody out. But I do appreciate everything that you do on our behalf. And thank you. Have a good night. Be well and be safe.
Thank you, Ms. Newman.
Mr. Torres.
Thank you. I just wanted to touch on the vaccine. I know we've discussed that numerous occasions tonight, what Jonathan said, and then how we're working with our population here within OCHN to get them their vaccines. Encouraging everybody to get it. I've kind of been through the process with trying to get it, and I know a couple of the board members were talking about it earlier, with trying to get it for my father, who's 79 years old. I was really moving every which way I could to try to figure it out. And it is a complicated system. You know, you can get it at some hospitals. Many of the hospitals are closed as to their list. But I encourage people to stay persistent on it. And if you know people who are elderly, to help them in whatever way that you can. Because my dad's 79 years old. You know, he's an immigrant from Mexico. He speaks English, but it's English is a second language. So without me being there to help him, I don't think he would have been able to get the vaccine. And he's a high risk category for sure at 79 years old. So reach out to anybody that you know. I know Rite Aid is offering it now to anybody 65 years of older. Just be persistent, go on that website. If you don't see any initial appointments, I did go on there when I was looking for my father, and we went about a 20-mile radius, and we were able to find one Rite Aid that actually was giving appointments. So just tell them to be persistent. Same thing with CVS. I think we'll be rolling them out soon, but many of the different locations, even as we're seeing with our partnership, there's niches. You know, they'll do the 1A category, but not the 1B. And I believe in the state right now, it's open to 1A and 1B categories, which is teachers, you know, direct care workers, first responders, court employees now, probation officers, criminal justice, things like that are open to it. But I know Rite Aid is only just doing 1A, not 1B. So, but just tell people to be persistent. It is a complicated system. We do hear that by May or June, there will be, we should be at a place where everybody will be able to get it that wants to get it. And that right now the 1C category, is my understanding, is the people with pre-existing conditions should be coming up soon. So, but again, it was really nice to hear all of the partnerships and all of the information that everybody on this board and our executive leadership has on the vaccine, and just keep encouraging people to seek out outlets to get it, because obviously I think that presentation that we had in the January board meeting was very eye-opening for me, very helpful, and I learned a lot from that. So I think we'll get to that point where we'll be able to get back to some normalcy in our lives. Thank you.
Mr. Lindemere,
No comment.
Dr. Guadalupe,
I would just like to thank, sorry, can you hear me?
Yes.
Yeah, okay, perfect. Just wanted to thank all the presenters for inspiring hope tonight. I thought it was great to hear from Hayley and from Dawn, as well as Deborah. I think hearing from the community is great, so that we can all hear those lived experiences. And thank you to Dana for including the video on Black History Month. Have a good night, everyone.
Mr. Furman.
I just want to echo again, thank you very much for the presentations tonight, the work put in by the staff as well as the members of the community. I really appreciate it. Everyone stay safe and have a good night.
Thank you, Adam.
Mr. Landsman.
Thank you. Two items. One is next week, Thursday, the 25th, is a study session from 5 to 7. It's part of our ongoing board orientation. We are going to focus on learning and getting better at using the Boardable tool. We'll have some folks from Boardable working with Sheila, working with us, so that we learn the tool better, the techniques better, and the tricks that go along with it. So I hope you will all join us for that board meeting. It will be a hands-on workshop. Okay. The second one is I welcome any feedback, or actually we all welcome the feedback from you, the folks we serve, and the public on our changes to how we're running the board meetings these days, and getting more of our board members to report out. So we'd love your feedback. So thank you. With that, that's it for my comments. If there's nothing else, then I'll bring this meeting to adjourn. Thank you. Good night.
See you next week, everyone.
Thank you. Good night.
You all.
Have a good night, everybody.
Good night. Thank you, Malkaya.